Hi everyone, this is Rozina Bhimji, your Ontario Dental Hygienists Association President. I would like to welcome you all to our first installment of 2024 ProvinciaLINK. I would like to express my sincere gratitude to each and every member of ODHA for your continuous support and commitment toward advancing oral health in our province of Ontario. Your membership provides ODHA with the resources to continue advocating for our profession in Ontario. Now it's with great pleasure that I introduce Heather Klienberg as ODHA's new president-elect. Heather has an unwavering passion for oral health care advocacy and a wealth of experience. She practices dental hygiene in Richmond Hill and Thornhill. Heather joined ODHA Board of Directors in May of 2022. She will serve as president-elect until May of 2025, when she will step into a president's role. I am excited and looking forward to working alongside Heather in advancing our profession in Ontario. As part of ODHA's membership renewal campaign, there was an opportunity to win one of 5 memberships. I am pleased to announce the winners: Elizabeth Morello, Suzanne Priestman, Jennifer Kaye, Fern Snyder, and Jody Goldstein. Congratulations to our 5 winners. Recently, I had an opportunity to attend Rendezvous conference in Thunder Bay, which was held from February the 1st to February the 3rd. The conference brought together dental community for a weekend of learning, networking, and professional development. The conference allowed me to connect with members of the Northern community, hear their concerns, and discuss ways to further support our profession in Northern Ontario. I was fortunate to be able to meet with dental hygiene students at Confederation College in Thunder Bay. During my meeting with students, I shared experiences as registered dental hygienist in Ontario, importance of professional development and lifelong learning. It was wonderful to see their passion and dedication. I would like to thank our past president Mahin Kasem and all the faculty team members at the Confederation College for allowing me to visit and engage with all dental hygiene students. ODHA remains committed to supporting dental hygiene education, providing students with resources and mentorship they need to succeed in their careers. ODHA is proud to announce its participation on January the 6th at the Fill in the Gap Clinic in Etobicoke. Our President-elect Heather Klienberg and our board member Suzanne Hoodfar spent a day at the clinic volunteering and making a positive impact on oral health of individuals in the community. Fill in the Gap is a nonprofit organization that uses existing community dental clinics in various locations across Toronto to provide affordable oral health treatment to low-income adults. We are grateful to Dr. Sanj Mahonta for allowing ODHA board members to participate in the community. Events like these highlight the importance of access to oral health care and positive impact that a dental hygienist can have on the lives of individuals in need. We know many of our members also give back to the community, and we want to highlight the important work you're doing to promote oral health by volunteering. ODHA has started a new column in Focus called ODHA Member Highlight. If you have not seen this, please read January Focus, in which we have profiled Evie Jessen, who recently received the Arbor Award from University of Toronto in recognition of her volunteer work in the Alumni Board of Faculty of Dentistry and representing the faculty at the College of Electrodes of University of Toronto. If you or someone you know who volunteers, please contact ODHA office so we can profile them in our future Focus publications. Thank you all for taking the time to watch the first installment of ProvinciaLINK 2024. Your dedication to staying informed and engaged is truly appreciated. Remember, ODHA is your association and your voice in the province of Ontario. I will now invite our Ontario Dental Hygienists Association CEO Margaret Harrington to provide to our members her important administrative updates.
Hi, I'm Marg Harrington, Chief Executive Officer of the ODHA. I will be focusing this edition of ProvinciaLINK on our recent advocacy efforts on your behalf. In December, Carolyn Weiss, Linda McEwen, and I presented to the CEOs of long-term care homes that belong to Advantage, a provincial long-term care association. Our focus was on educating the CEOs about the importance of oral health to overall health of their residents, and how dental hygienists should be integrated into long-term care homes. This followed a presentation to members of the Ontario Long-Term Care Association in the fall. We are continuing our discussions with these two associations to further our work in this area. In January, ODHA made a submission in response to the provincial government's pre-budget consultation. Our recommendations, which aim to increase access to oral care in the province, included enhancing the scope of practice of dental hygienists, including dental hygienists in long-term care homes to meet current legislative requirements for oral care, aligning the Ontario publicly funded oral health programs to the Canadian Dental Care Program, and supporting recruitment and retention of Ontario's dental hygiene workforce by including dental hygienists in the government's Portable Benefit Initiative. We encourage you to read our submission, which is available on the website, for a more in-depth understanding of these recommendations. I also want to share an update on the Canadian Dental Care Program. I wrote about the program in the January edition of Focus. You would also have received member bulletins over the past few months sharing important information. I hope you've had an opportunity to participate in the webinars offered by Health Canada in February and March. The February webinar recording is available on the CDCP website, and there has been a commitment by Health Canada to also share the recording of the March webinar. As background, ODHA was first invited to join in discussions with Health Canada in November, and we met a number of times over the following months. This was an opportunity to review and provide our feedback into draft documents. The Provincial Dental Hygienists Associations and CDHA have worked very collaboratively to provide the federal government with the profession's feedback. All associations representing the three oral health professions involved in the CDCP have come to understand that many of the decisions related to the program were already made prior to our respective meetings with Health Canada. As a result, only a few of our recommendations have been incorporated into the first iteration of the program. In our discussions with Health Canada, we highlighted the need for streamlined administration of the program for providers and a comprehensive public awareness campaign, so the burden of communication of the program would not rest on dental hygienists and other oral health providers. We were pleased to see Health Canada's recent release of the Stakeholder Toolkit. Although the program is in its developmental stages, we believe further enhancements are needed to fully benefit the patients the CDCP is designed to serve. In our discussions with Health Canada, we have been advocating for and will continue to advocate for a greater focus on prevention. Only through this focus on prevention can real changes be made to the oral health status of the program participants. We are continuing to meet with Health Canada through working groups. I recently have been appointed to the fee setting working group to provide input into the 2025 fee grid. However, the federal government has told us the working group is advisory only. The 2024 abbreviated fee grid was released prior to the working groups having their first meetings with Health Canada. Health Canada has indicated the full 2024 fee grid will be released in April. As a result, the professional associations for dental hygienists, dentists, and denturists had no opportunity to provide input into the fees listed in their respective 2024 fee grids. The 2024 fees were unilaterally set by the federal government, which based the fees somewhat on the NIHB program. The fee-setting working groups will apparently meet monthly until December, at which time it will disband, according to the current terms of reference. In my feedback to Health Canada on the draft terms of reference, I have asked for the working groups to continue beyond 2024 to ensure professional associations have a forum to provide input into future fee grids. Please stay tuned for future updates on the program. Thank you and happy spring.